Hello and welcome to my channel. This is Isaac, simple and real. Kindly remember to like, subscribe, and share. We are now continuing well with our new season, sexually transmitted infection. And our new topic of today will be chlamydia infection. Thank you. For those who have not yet subscribed to my channel, kindly remember to subscribe to my channel. Go and click subscribe, like, share to your friends so that they can be able to learn more about this new channel as we continue impacting more lives, improving our society to live a more better life, having the awareness about their health issues and how they can prevent themselves from getting sexually transmitted infection, HIV, and for those who already have, how they can be able to be treated and to be taken care of in a healthcare facility. Thank you. In our lesson today, we'll get to understand several things. To begin with, we'll start by defining what is chlamydia infection. Secondly, we'll go to risk factors to getting chlamydia infection, or the predisposing factors to getting chlamydia infection. We also go to presentation or clinical presentation or signs and symptoms of a person who is suffering from chlamydia infection, how a diagnosis is made in a healthcare facility, treatment and prevention. So kindly cruise with me to the end so that we can be able to learn together and so that we can be able to impact more lives as we continue empowering our society to live a more healthy life. Thank you. Kindly do not forget to subscribe, like, and share to your friends so that we can be able to impact more lives, so that they can be able to live a more healthy and a more comfortable life, having to live more having been taken care of their health. Thank you. To begin with, I'll start by defining what is chlamydia infection. And basically, this is a sexually transmitted infection that is usually caused by a gram-negative bacteria that we call chlamydia trachomatis. This bacteria is not always sexually transmitted. We'll get to know more about how it can be transferred from one person to another using the furs of the limbs of the flies. Kindly follow me to the end so that you can be able to know how flies can be able to transfer the bacteria from one person to the other using the fur of their limbs. In the meantime, we'll be talking about the sexual transmission. Thank you. Now, about the sexual transmission. Who are the risk factors, or what are the predisposing factors to one getting this kind of infection? Usually, as we said earlier, this is a sexually transmitted infection, and a person having several sexual partners or having sex with multiple sexual partners increases the chances of you getting this kind of infection. The other risk is having unprotected sex or having sex without condom with the persons who you do not know their STI status. This gives you a double risk in getting HIV infection and also a risk in getting chlamydia infection. Thank you. Now, let us get to understand how does a person who is suffering from this kind of infection present. Usually, the symptoms are usually almost similar to a person who is suffering from gonorrhea, with some exemptions. Let's go to the men who are suffering from this kind of infection. A male who is suffering from chlamydia infection may experience testicular pain. They may also experience pain while passing urethra, but in this case, they usually do not exhibit discharge or urethral discharge, but they will experience pain while passing urine. Then you may experience, as a man, you may experience lower abdomen pain and some back pains. To the ladies, they usually exhibit more symptoms. Rarely, most of them present with symptoms because most women are initially most of them are asymptomatic. But for those who experience symptoms, with this kind of infection, they may experience uh, uh, spotting or pervaginal bleeding, that is pervaginal spotting or bleeding in spots. Uh, the other one, they may experience lower abdomen pain. The other one is lower back pain, and they may also have discharges. They may also experience vaginal discharge. The other one, they may also experience itchiness or pervaginal itchiness, especially after passing urine, and in other cases, they may experience, even without passing urine, they feel vaginal itch. Thank you. Now, let us go to other spread, or because as we said earlier, this kind of infection can also be spread to the eyes. Usually, to the eyes, it is not necessarily that it is transmitted sexually, but someone who touches a vaginal seminal fluids and then touches their eyes, while the vaginal fluids or the seminal fluids contain this kind of bacteria, they may transfer the bacteria using their hands to the eyes. However, for the children, one child in a community may be suffering from a trachoma infection, that is an eye infection, and then the flies, because of poor hygiene, usually lands to the child who is suffering from trachoma, because they usually exhibit eye discharges that are usually mucopurulent and foul smelling. And then the flies, using the fur of their limbs, they usually transfer the bacteria to a healthy child or adult. And how will this person present? A person who is suffering from trachoma infection, they usually start swelling of their eyelids. Their eyelids start swelling. Then they experience something that we call inclusion conjunctivitis. When you have a swollen lid, this lid usually turns your what we call them, the eyebrows inside. And when you blink, you usually scratch your sclera. What happens when you cause injury to your conjunctiva? You'll experience conjunctivitis or inflamed conjunctiva. Conjunctiva is usually the upper part or the colorless part of your eye on top. Now, when you cause injury to your conjunctiva, this causes irritation of the eye. And with a swollen lid and now an injured conjunctiva, it progresses to causing more harm in your eye, which can lead even to blindness. Because when you injure the conjunctiva, then you proceed to injure the sclera, automatically you're causing grievous damage to your eye. However, this kind of infection is treated, but basically we start with it's usually treated surgically and even with antibiotic. But the best care is proper hygiene of your face. This can prevent you from getting this kind of infection, and for those who are suffering, from spreading to other people. So in this kind of case, proper hygiene is the paramount. When we were talking about sexual transmitted infections, we said different people have different orientations to sex in matter sex. And since we may not be in a better position to control the society on their way of sexual activity, it's good that we get to learn how this kind of bacterial infection presents in different orientations. We have already talked for the sexual, when you're having the vaginal sex, how it presents. Now, when this bacteria gets to your mouth, you may present with upper airway infection. Upper airway infection, this is where you present with congested nose or runny nose. Then you may present hoarseness of voice. You may present mild cough, low-grade fever, or you feel hotness of the body. And also, you may also present sore throat. When this bacteria goes further to your lungs, you will present with pneumonia-like presentation. That is chest pain with low-grade fever and also mild cough. Now, let's go a bit deeper to this kind of discussion. Thank you for your continued support. Thank you for following to this channel. Let's now go to how do we get to treat this kind of infection, or how do we get a laboratory diagnosis. Usually, this kind of infection is usually treated clinically. And before we go to diagnosis, let's get to understand, can this kind of infection be transferred to the unborn child? What happens? The bacteria may not be transferred to the unborn child if the mother gets infection when she is pregnant. However, it may cause chorionic infection, which may affect the pregnancy by causing premature labor. So, it may not infect the baby, but it may infect the chorion. That is the sac that usually harbors the baby in the uterus. Thank you so much. That is what I had forgotten. And now, let's go to the diagnosis. In the diagnosis, we usually make this kind of diagnosis clinically, but there are other DNA investigations that may be done to be able to diagnose or to isolate this kind of bacteria. One of them is a NAT test, or the monoclonal test. These kind of investigations They're usually done in the bigger laboratories, and they're effective and they are confirmatory. However, even without this kind of laboratory investigations, a diagnosis can also be made, and treatment can also be made. The complication part of this kind of infection is usually it may progress to your, for the ladies, may progress to your fallopian tubes and cause salpingitis. It may also progress upwards and cause pelvic inflammatory disease that usually it's a long-term treatment. So it's always very good to prevent ourselves. And how do we prevent ourselves from this kind of infection, especially the sexual transmission? If you're having sex with a person of unknown STI status or unknown HIV status, kindly use condom protection, or kindly use a barrier method, that is, use of condoms. When you have been diagnosed with any kind of STI, kindly follow up to the curage of yourself so that you stop transferring or transmitting the same infection to other people or to your loved ones. When most people who are infected get prompt treatment and get cured, we prevent the spread of this kind of infection. Now, how do we get to treat this kind of infection? Usually, the treatment of choice for this kind of infection is usually tetracyclines. Tetracyclines, there are several. We have the tetracycline tablet, we have doxycycline, and the healthcare worker will decide which one to give you. They usually, especially for doxycycline, usually treated for about 5 to 7 days. Then other treatment that may be given could be injectable cephalosporin, that is ceftriaxone. A healthcare worker may decide to prescribe you a macrolide class of drugs, that is an example of azithromycin or erythromycin. Or a healthcare worker may decide to prescribe you penicillins like amoxiclav. In all this, they are very effective against chlamydia infection. Thank you for your continued support. If you have not yet subscribed to my channel, kindly do so. Kindly subscribe to my channel, like and share, so that more people may be able to learn more about this kind of sexually transmitted infections as we go deeper to understand different sexually transmitted infections, mode of transmission, their impact to our health, how we can prevent them, and how they can be treated. Thank you. This comes to the end of my lesson today. Kindly, if you have not yet subscribed, kindly subscribe, like, share, and let more people, let more of your friends learn about this kind of infection. And these services are all available in any government health facility, private health facility, and we can also be able to support you where you need clinical or counseling support in our healthcare facilities. Thank you and God bless you. Bye bye. This is Mkurugenzi Maish, simple and lean, on Puma Health Solutions. Bye bye.